6.5, A, consideration of priorities for fiscal year 2026 community project funding, and B, discussion and direction to staff on which priorities to further pursue for potential submittal to Congressman Thompson.
And Mr. Chair, if I may, just for clarification, now you're sitting in as the County of Lake Board of Supervisors.
And we have now, we have closed the Board of Equalization, and now we will be sitting as the Lake County Board of Supervisors to accept this. And so I'll give the floor to Matthew Rothstein.
Good morning, Chair Crandall and Supervisors. Matthew Rothstein, Chief Deputy County Administrative Officer. And I'm joined in the room by Benjamin Rickelman, who's our Deputy County Administrative Officer, and others for this item. Staff are seeking your board's direction regarding submittal of fiscal year 2026 Congressional Community Project funding priorities. Congressman Thompson has asked that only the highest priority projects are submitted, and his office's deadline is Friday, March 7, 2025. Past successfully funded projects have enjoyed broad-based community support. You may recall the Lake County Sheriff Administration and Operations Center project, for example, repurposing the armory, has twice been supported for funding. Our Full Circle project feasibility study update was likewise funded, and the Middle Creek Restoration and Kelseyville Sidewalk projects are two further county-specific submittals that have been supported. Your direction will be appreciated with regard to which projects should be further vetted for potential submittal. Congressman Thompson will value your affirmation of the county's priorities. It's important to bear in mind it may take 18 to 24 months to receive funding from the time of submittal, and projects cannot include requests for ongoing multi-year funding. So not every project is a strong fit for this particular opportunity. Mr. Rickelman and I will briefly introduce 3 project concepts included in this agenda item, and we'll invite your questions after the initial overview is provided. So first, the South Lakeport Regional Water Resiliency and Fire Protection Project is a cooperative intergovernmental effort between the City of Lakeport and County of Lake. Staff proposed submitting this as a $7,211,500 request. Funding would extend the City of Lakeport Municipal Water Service to a currently unserved County of Lake jurisdictional corridor along South Main Street to Soda Bay Road. Spanning approximately 8,000 linear feet of water main, 58 2-inch services, 16 hydrants, and 4 fire services, this project aims to significantly enhance regional water infrastructure and resiliency. This project would likewise enable future opportunities for interties with the Big Valley Band of Pomo Indians and County of Lake's own special districts, setting the stage for a consolidated and robust regional water system. After the posting of your board's agenda, a letter of support was also received from Chief Willie Cepeda as Operational Area Fire Rescue Coordinator. And we have Kevin Ingram, our City of Lakeport City Manager, and Glenn March, our Public Works Director, Robin Bore, our Special Districts Administrator, here to speak to any questions you have once again after the initial overview. The next project concept for your consideration is the Reentry, Housing, and Workforce Development for Those Returning from Incarceration in Lake County, California project. This $5 million request seeks funding to develop individual living space for at least 20 justice-involved individuals and engage those eligible in local workforce development initiatives. North Coast Opportunities Build and Home Hardening programs may be among those local programs, and NCO has provided a letter of support for the project. Your board will recall $5 million in Community Corrections Partnership funds have already been dedicated to this project. The total cost is anticipated to be $24 million. Lakeport Police Department and Lake Family Resource Center have provided letters of support in addition to NCO for this project. And Wendy Monfranz of Lake County Probation is in the room and here to answer any questions regarding that particular concept. And now Benjamin Rickelman will provide a brief overview of the third concept.
All right. Go ahead, Ben.
Good morning, Board. Ben Rickelman. I'm a Deputy County Administrative Officer. I'm here regarding the Lake County Healthcare Education and Innovation Center. I have with me Cameron Fasano, who is a business development specialist with Sutter Healthcare, who's a major partner on this project, and Nicole Flora, the executive director of the Lake County Economic Development Corporation. And then online we have Tim Gill, who is an assistant superintendent with Canocta Unified School District. I'm going to let Cameron lead the main part of this presentation. We presented on this project about a little over a month ago, so we'll keep it fairly quick, but just want to give you an update on it and why it's, we think, a great project for the community.
Thank you, Ben and county staff. I appreciate your time this morning to review this project for consideration. Next slide, please. So this project idea first came about through conversations that the Sutter Lakeside Hospital CEO, Tim Stevens, had with community college executives about workforce needs, specifically around healthcare, the healthcare industry in Lake County, and what did that look like. As you can see from the slide, healthcare and social assistance makes up currently about a little over 19% of the workforce in the county, and that is only expected to grow. I would also like to note that under government is where we find our education workforce as well. So by 2030, we expect that the healthcare industry to be right around 23% of all workforce in Lake County. But what we wanted to do was figure out what were the areas of need. Next slide, please. So through research and partnerships, we have identified not only is there a critical need for nursing and physicians, nurse practitioners, physicians assistants, but there's also a critical need developing for support staff. The first 5 areas that we identified for critical needs would be MAs, so medical assistants, physical therapy assistants, certified nursing assistants, licensed vocational nurses, as well as licensed clinical social workers. So the idea was, what do we do, right? How do we address this critical need? Next slide, please. So it was the idea of Mendo Lake College, Workforce Alliance of the North Bay, Redwood K-16 Collaborative, and the Lake County Chamber of Commerce to host a healthcare workforce summit. This summit was held last April, so April of 2024, with leaders from healthcare industry, education, public service in the form of fire departments and EMT workers. And they spent an entire day collaborating and identifying what the needs were, what the gaps were and barriers, and then what could be potential solutions. So key challenges that were identified were there's training gaps, there's barriers from high school to college, there's also career pathway gaps, and then being a rural community, we have sometimes trouble with retention of medical staff. So an idea was to grow our own workforce. What could we do there? So myself, Tim Stevens, and our Sutter team proposed a solution. There is a vacant building on the Sutter Lakeside campus that was currently not being used. It's around 6,600 square feet, and we thought this could be a perfect workforce development center. But we didn't want this just to be a Sutter healthcare project. We really wanted it to be a community project for all of Lake County. So we, next slide, began with a small group of stakeholders that represented education, all three large healthcare industry partners in Lake County, as well as county government. And we started brainstorming, what does a workforce development center look like? Is it mobile? Should it only be healthcare? Should we bring in other industries? And this group, over the course of 3 months, came to the finalization of this Lake County Healthcare Education Innovation Center. It would be brick and mortars. They agreed to take advantage of the 6,600 square foot building on Sutter Lakeside property, being part of phase 1. And then we also extended our community stakeholder to a wider variety of organizations. And I do want to look at the mission statement just really quick and bring your attention to that, because it really is going to serve as a hub for education, training, professional development. And as you'll see next in the presentation, there'll be a community health impact as well. Next slide, please. Project partners. We have project partners across industry, education, and community. While this started with a small group of 6 organizations, we have grown to 16, all with input on how this center should be developed, organized, and run. Next slide, please. So this education center will have 3 key areas. The first is our SPARK component, so students promoting awareness of real-world knowledge. This is a field trip-based study program for 5th through 8th graders. There'll be interactive simulations, guided tours and demonstrations, workshops and mentoring. I will have to say, on a recent field trip to a simulation center in Sacramento, we witnessed real-life robotic dummies, mannequins, that had a pulse, that could give birth, that could simulate birth, and even have retinal display. So if you're having a stroke and a pupil pops and dilates, it actually does that on the mannequin. Imagine being able to learn how to stop the bleed when you're in 5th grade, and how that can translate into maybe saving a family member's life. The second component of this training, of this center, will be a training component. It'll be a training component for our high school students, as well as adult education, working currently with LCOE on their MA and CNA program pathways. We'll also be working with the high schools on what is called their CTE healthcare pathway programs. The idea is for when students graduate for high school, they'll be able to sit for a certification and be hired immediately. So this will include not just work-based learning, mentorships with healthcare organizations throughout the county, but also real-world experience. And then part of the training also is for professional development for current healthcare workers. The third component is all about our community. So community-focused aspect, which really emphasizes health literacy and life-saving skills for all of our residents. This could come in stroke support groups, diabetes education, lactation services for expectant moms, and even babysitting certification. These are several programs identified that could help the community at large. Next slide, please. So we have identified 3 key phases that are needed to bring this project to fruition. We're currently in the planning phase. The anticipated cost is $1.5 million, and this will be facility design, initial build-out plans, curriculum development. We have applied for funding to help develop governance and operation structure for the center. We anticipate this to be a partnership between our education entities, but it's really too early in the planning process to share all of those specifics. The build-out phase will take about 12 to 36 months. This will be the building remodel, purchase and implementation of the simulation equipment, curriculum finalization, and when the build-out is complete, we are going to begin with programs that are ready. So students will be begin visiting the center as early as August of 2027. And while we are developing a robust curriculum that spans 5th through 8th grade, high school, and adults, we may be starting with 1 or 2 programs in 2027 as the rest of these programs reach their finalization. Phase 3 is full-scale operations, program expansion, community development, and continue to have innovation in healthcare education. Anticipated yearly operations is $650,000, and again, we expect that the yearly operations will be education institution partnerships. So now we'll get to the funding. So next slide, which is why we are here today. Next slide, please. It's okay. Our total anticipated project cost is $8.75 million. We are here requesting $3 million for the community project funding. We have secured funding from 4 areas that you can read on the slide. We have pending applications totaling over $2 million. And then we have in-progress applications in addition to this request with the EDA, California State Appropriations, as well as the County Medical Services Program. Now, you've heard from me, business strategist, but I would like to turn it over to Tim Gill because he really wants to talk about what the impact of a project like this can mean on the students of our county. So Tim's online. If we can unmute his microphone, it's Tim's iPhone.
Tim's iPhone. Come on.
And if we have a glitch, I have his statement that I can read. Okay. So if you guys trust me, I'll be glad to read his statement if we're having some technical difficulties.
We'll just wait 1 second and let me know, Johanna, if you...
Good morning. Can everyone hear me?
There we go.
Yes,
All
there
right,
we
go ahead, Tim.
All right, thank you. My name is Tim Gill. I'm the Assistant Superintendent for Educational Services for Conocti Unified School District. I've been involved in career technical education programs in our high schools in the county for about 20 years, and I'd just like to take a moment to talk about the impact that I believe that this project can have, not only on the quality of our career technical education programs as in the healthcare sector, but also the impact that that could have on the workforce pipeline that Camlin was talking about. Over the last 10 years, all of the high schools in the county have done an outstanding job of increasing the number of career technical education pathways that are available for students. At Lower Lake High, we have currently 10 pathways, 10 different training programs for students. It's usually a 3-course sequence, and some of those courses, like our culinary program, has a Serve Safe certification, but the piece of this, as far as how it impacts our workforce, is that our students graduate from high school without having had any real-world work-based learning opportunities. We just don't have that infrastructure in place. If we have a facility like the Healthcare Career Innovation and Simulation Center, that we can take students to beginning as early as 5th grade to develop that spark, so that when they get into high school, and if they're part of our either patient care pathway, our emergency services pathway, which could eventually end up with certification as an EMT, we will actually be able to have work-ready students graduating from high school. Because basically what we've been doing for decades in the county is that we train students through the 12th grade, and then we send them on their way, hoping that they go out and either go to the community college, go to four-year university, go to trade school, get some kind of certification, and then we hope that they come back. And if we truly want to grow our own, as far as our health career pathway industry, or our health career industry, and if we want to grow our own workforce, then it's critical that we have a facility like the Innovation and Simulation Center. Thank you.
Thank you. Anything to close with?
Thank you. Thank you for your time. Thank you for your consideration. Appreciate it.
All right. Matthew, do you want to close anything out before we get to questions?
I don't have any closing thoughts. I just know that we do have representatives of both the other projects here, and appreciate your consideration of all three of these meritorious concepts and your further remarks and discussion.
All right. I just have one real quick, and I'm just not remembering, but do we commonly request 3, or have we done more before, or is it usually 3 and then? Yeah. Okay. All right. That's my only question. You had one, Supervisor Iska, and then.
Well, are you asking us to just pick one?
No.
Okay, good. So it wasn't super clear in the memo. Okay. And then which, I know in the past we've been really strategic about where we're asking for these funds to come from so that they're more competitive and we're not asking for the areas that are extremely competitive. So I'm guessing that, well, can you just elaborate on the research that you've done to make sure that we're positioning these the best that we can?
Yes. So these projects would be in likely the USDA Rural Development or the Economic Development Initiative categories. Both of those are actually fairly highly competitive. But these are the projects that enjoy the broadest based community support of what was received this year. So typically, like I said in the preamble to this item, the projects that enjoy the broadest community-based support are most likely to be funded. So that's why we're bringing these forward.
Great, thanks.
Vice Chair?
Just before I ask questions, I was going to clarify if we were going to hear from any other staff regarding the 3, or if not, that's okay. I was just curious.
CEO?
Yes, generally we don't do a presentation. However, with Sutter, it was publicly stated that they would be given a presentation, so we combined it. But that's why we have the other staff members here. And if they want to come up with your board's pleasure to give a 5-minute overview, or even something from City Manager Ingram, just about the need and discussions that have been going on.
Go ahead.
All right, thank you, Mr. Chair, honorable board members. I think Matthew gave a very good overview of the project. So, I think that, firstly, just wanting to thank Congressman Thompson's office for the outreach that they do in regards to this matter. There's been quite a bit of, piece in there. Obviously nothing's guaranteed going forward, but I think that in particular, this South Lakeport Regional Water Resiliency and Fire Protection Project it's ripe in the sense that there's a large community need there. I'm very happy that Director Glenn March with the Public Works Department here is pushing to the completion of the South Main Soda Bay Road Corridor project, which I think has been 20 plus years or so. So I think the ripeness exists to get a water line underground there before we put that road project in. I think that the recent dropping of the local responsibility area fire hazard severity maps only further puts the need for this type of project to be put in place. I believe that entire corridor area down here that's being discussed from the existing city limits all the way down there to Manning Creek is either in very high or high designated or proposed designated lands. It's no secret that there are existing small water systems out there. I think the official lingo is non-transient water systems. Those are essentially, private water systems that serve a certain number of individuals that requires them to, have some sort of reporting to the state. They're not physically community water systems in the same sense that some of the other special districts are. But we know that those are systems that for years have been impaired by either quality or quantity issues, or just the sheer cost and requirements that is necessary to comply with state regulations on those systems. And those include some big players out there. And then there is of course the fact that we have a highly developed industrial corridor that contains several propane tank farms, a building supply store, the transfer station, that are high risk areas to fire, and we are currently operating without any fire suppression system in that area. So I think that the fact that this comes with a $7 million price tag, I think we're obviously know that that's going to be something that's going to have to be negotiated out. The likelihood that we receive a full $7 million ask is probably unlikely, but I think giving a whole kind of comprehensive aspect of what the project is. I know just in my experience crunching the numbers on this for the past 10 years or so that when we first looked at this project, it was only about $1.5 million. And so I think it's also stated that time is of the essence there, that you wait too long and all of a sudden that's going to double again. So I think there's absolutely, and what I'm primarily here for is regardless of whether this is supported as a community-funded project, or it's very possible that there are no community-funded projects this year. But I think regardless of that fact, I think the need for the cooperation between the City of Lakeport, the County of Lake, the Lakeport Fire Protection District, all of our fire protection districts, I think this is a very needed project that in any rate that this won't be energy lost, even if it's not selected. That this is something that we need to continue to make a high priority. So certainly open to any questions, but I think Matthew gave a very good overview of the physical aspects of the project.
I know we have a couple more questions, but go ahead, Wendy.
I, too, would also like to thank Congressman Thompson's office. They've been very helpful with feedback, and Matthew as well. And all of our community partners who are joining in our request for our proposal. This is in addition to the housing project we're already developing. We're adding a workforce development portion to it, where we would work with NCO, the BUILD program, and their home hardening program, so we can train people who are going through using our services and having job development skills come to them while they're also in our program. So our hope is that individuals will be working on building the project and then eventually move into the project and have some ownership in it. Then they'll also have the opportunity to work on the home hardening project that NCO has already received funding for the Clear Lake Riviera. So I think this makes our whole housing development kind of complete, where we're going to get the top two needs of people who are coming out of incarceration with housing and job skills, and put them on the right path to succeed in Lake County.
All right. Is there anyone else before I go through with questions? Okay, Supervisor Sabatier, Vice Chair, then Supervisor Pyska, so go ahead.
Thank you. All good projects. And I know that Vice Chair Rasmussen, or maybe it was Supervisor Pyska, anyways, asked about what are you asking from us? Because here on the memo it says which priorities to further pursue. Do you want us to prioritize the projects of 1, 2, 3, or just equal projects? Because I have personal preferences as to which one I would prefer to see over others, so that we don't go for the easiest, we go for the most impactful. But kind of curious as to what I'm kind of left in a cloud as to what exactly is being asked of us.
Yeah.
Thank you, Chair. We weren't going to ask you to prioritize, only because we've only presented 3, which is what we generally do. We don't know how they will be vetted in DC. What we don't want to do is leave anything off the table. We had such a tight timeline on this, from time of notice to turnaround, that I just think that I don't know if you could develop a consensus to prioritize 1, 2, or 3. But we've never done that before. What we've done is submitted all those presented in that the board supported. Because again, it goes back and forth. We may not even get out a subcommittee on some of these, so you don't want to limit the number that you do. Or I don't know what the priority setting would serve at this point in time.
Okay.
All right. Good. Vice Chair?
Well, to that point of Supervisor Sabatier's, I could see where that may come up down the road, but at this point, I'm definitely in favor of submitting all the projects to get those in the system. Starting with the Healthcare Innovation Education Center, I think that's a huge one. It benefits the entire county. They mentioned it, with it being the entire workforce, and then we have all of our schools, our colleges, everybody is on board with this, and there's just a lot of benefits down the road to economic development and, training our own healthcare professionals here. We know it's difficult to recruit those folks in. The probation or the housing, the workforce development there is another critical component of our community. That's a great project as well. And then the fire, the water system on South Main, that's been a huge need for a long time. There are severe fire dangers down there, and we don't have any effective fire suppression systems down there at this time, and that water is critical for those protections. So I'm in support at this point of submitting all of these projects, and if we have to define it further later, we can.
All right, Supervisor Pyska.
Yeah, I'm in support of all. I'm in support of all 3 of these, and I agree with the prioritization too of having these people services first and programs first. But I am concerned of the high price tag on each of them. They're higher than what we usually submit for, and I'm worried about them being competitive against each other.
All right, with that, we'll go ahead and open it up to the public to see if there's anyone that would like to comment on 6.5. So we'll go ahead and start in the chambers. Chief, if you'd like to come up.
Good morning, Board, Chair. Thanks for this opportunity. I actually want to speak to all 3. I didn't know I wanted to speak to all 3, but I do. Obviously, the fire suppression system on South Main is a huge concern for us. As recently as this last June, we had a transfer station fire that demanded 68,000 gallons of water be trucked in an attempt to fight, control, and bring that fire under control. That's a lot of water, and it ties up a lot of resources. So any of those incidents down there are going to pull and stress this our county and our other fire districts' resources to bring in and help fight the industrial development that we've had down there, and those other businesses that are down there as well. It is very demanding, and the potential for loss, both economic and structural, is pretty high. So firstly, I would voice my support for that project as well. Secondly, for and I'm sorry I don't have the names of all the projects in front of me, but the housing coming out of the corrections facilities and the workforce development for those folks, I support that. Would love to see that. Had some initial concerns, but after reviewing the project closer, really have come to like that project as well, and what it means, especially since our department interacts with a lot of the homeless, having the county homeless shelter. We interact with a lot of the folks that need additional behavioral health services, because we have all of those services located here in Lakeport, and for them to have access to that and the housing and the workforce development, it's just critical to help them get their foot going down the right path. Lastly, the workforce, I'm going to call it workforce development for our and the education for our kids coming out of the high schools. The fire chiefs did a informal study. We found that folks that we bring up from our school system and train here stay here, or tend to stay here, and folks that we bring in from outside stay here for 1 to 2 years and then disappear again. So rather than being a training ground for folks outside of our county, why aren't we growing the training ground for our folks here? And I believe, and Chief Cepeda's not here to back me up on this, but I believe when we looked at just the EMT program that we're bringing into the high schools the last 2 years, that I think there was something like 15 to 19 other career fields that those folks could branch off into just by their EMT certificates. So all good stuff. Want to voice my support for all of them, and wish the county well in its submission to get these funds brought back to the county from Washington, D.C. Thank you so much.
Thanks, Chief Wrights. Anyone else in the chambers? All right.
Hi, Michael Green. I'd be remiss if I didn't stand up here and support the South Main Street water supply line project, which has kept me up at night, not just as a recovering former supervisor, but as a city council member before that. The need is so urgent, and it's billed as a regional water supply project, but in terms of the fire risk that we're trying to mitigate, that's regional fire risk too. When you have propane farms, large scale hardware and lumber stores, depending on when that fire happens, and if it's in a high wind event, that could pose a regional fire risk to the communities east of there for sure, and some potential for mass casualty events. That said, I'm with the chief. I love these other projects too, and one advantage I think, if I do recall, of moving all these forward now is if there is some back and forth with the Congressman's office to suggest ways to refine it. That's a helpful exercise. I can think in particular on the South Main Street project that there may be some advanced planning that we would have to do to update some previous studies of how stuff works out there. So that's just it. I support all of them, but I'm very, very fond of the South Main Street project. Thank you.
Thank you. Any other comments from the chambers?
I have one.
Was it repeating that, or? Oh, go ahead. Go ahead. Just go.
I am really impressed and really like the programs, and I like bringing the career paths to the high school. So what Willie Cepeda and the fire department's doing in some of the schools here, I would like to see that expanded, as well as some of the law enforcement and the nursing and a lot of these programs. So I'm really happy that those are moving forward. Thank you.
All right. If there's no one else in the chambers, we'll go ahead and go to Zoom.
Thank you, Chair Crandall and supervisors. This is Margot Kambara, Lake County resident. I have a comment on the Lake County Healthcare Education and Innovation Center proposal. As the chief has noted before, Grow Your Own concept has great potential, especially for retention of our young people. And I understand the focus of the program to target position level at the assistant level, because the training can be provided locally and the students can be placed immediately and employed. What I would suggest is for career growth and meeting Lake County's healthcare needs, that another component of the program be incorporated, perhaps at a later phase, and that is to include training at the physician level or the physician's assistant's level. Thank you.
Thank you. Anyone else on Zoom? All right, if there's no other public comment, I'll close public input and bring it back to the board, and then we'll start with Robin. Go ahead.
Good morning. I'd like to thank Kevin for his collaboration and support of this project as well. Some of you may be aware we have $2 million set aside to deliver this project, and $2 million won't get us very far. So I believe that we have pretty much a full plan, environmental, right-of-way, all of that kind of stuff already identified. And so we have turned it over to our engineers to verify the status of what we've actually accomplished, and but we believe that it's basically a shovel-ready project, and we would have that $2 million there as match. We're also looking at what other things we could do in the interim if this funding doesn't come forward with that $2 million. If that's a tank and additional locations for the fire department to be able to pull from water, and any interties if this is fully done.
Thank you.
So it's actually a $10 million project.
This one doesn't include any interties and stuff like that would be needed. And I'm guessing he's probably got a lot of design money in there as well, to make sure that, that we're fully funded. So yes, a water project of this magnitude could end up being $10 million, depending on how far we go and how many interties we do.
Do you want to have another question? Go ahead, Supervisor Sabatier.
I know we're not prioritizing, but I'm still going to mention, I think that the Innovation Center is the most upstream. I think that if we can provide our youth access to opening up doors, that we're going to see a whole lot better outcomes in our community. And so I think that to me is my number one, because it has such a long-term impact. I understand the water situation. I'm trying to forget about the past in order to move in the future. But these are things that could have been resolved in the past. Unfortunately, we've hit some hurdles and some bumps. Just need to have a little amnesia and move forward with that one. But to me, I just can't help but remember Department of Justice report. Those who do 1 to 2 years of college have a 75% less likelihood of going to jail, and we need to get our youth activated into career pathways at a higher level than what is already being provided at our schools. I appreciate what they are doing at our schools, but I think this is the next level. I have seen it at Congressman Education Center when that was a health magnet school. Those kids, many of those kids still work at our local hospitals today. And so the impact of getting them enthusiastic about those type of pathways, I think makes huge differences. And so just wanted to at least put my 2 cents behind that one.
Thank you for that. Go ahead, Vice Chair.
Yeah, just a question, and I know our CAO staff and our office is going to be, communicating heavily with the Congressman's office and working on these. As I understand what the Congressman's initial amount for his entire district would be $15 million. Do I understand that right? Normally what he puts out?
Congressman Thompson is able to submit 15 projects as opposed to 15 million.
So there's no...
It has been common that projects that we've had funded were in the neighborhood of $1 million. Those frequently have been reduced from higher amounts, and the Congressman's office has generally encouraged us to make their office aware of the comprehensive project.
Okay. So as you're communicating, is that something that will come back to us on if we have to make any changes on any of these submission amounts, or?
Yeah.
If I may, Chair. It'll come back to the board if there's significant changes. Otherwise, this is a really fast-moving train, back and forth with DC, getting it refined to the point where it actually can get submitted to the subcommittee prior to full committee review. So we'll make that, I don't foresee any significant change, but if there is, we'll bring it back to the board. But it'll be a quick turnaround. It'll be tight. So I'm just making you aware of that.
Okay, thank you.
All right. Go ahead.
Just final comment. There is also a Senate, I don't know what it's called, it's not community project request. If we're looking at large regional concepts, maybe we need to make sure that we get in touch with our senators for the state of California and check in as to what that timeline is. I do not believe we've ever submitted a Senate community project or regional project, but I think this is one of those times where we may be cutting ourselves short if we don't try.
All right. Yes, so I'll just state that I support all three projects. I did ask a couple questions here and there, but maintenance is not something that can be funded by these appropriations. So, yeah, because I brought up a couple of things, and I was thinking about roads as well, because we have roads plans, but at the same time, I don't know if that's determined as maintenance or what. So I know it has to be shovel-ready projects or something like that. So I also was worried about our senior centers with the situation with the OAA. I don't know how that could be implemented with this, though, because it's it has to do with giving food and other things like that. So I don't know how we can quickly turn around something like that. So I'm in support of these. And if there's not any other comments, we'll look for action here. CAO?
Thank you. One last comment. With your board's approval, what we'll do is for the 4th, and I know we're missing 2 of you, but if you've affirmed today, we'll bring back the resolutions required for submittal on the 4th because of the tight turnaround on the 7th.
Okay.
With your permissions, of course.
So do you need action or just direction?
Well, just want to make sure everybody's amenable to that. I know that, okay.
Yeah, I am.
Okay.
All right, so
Do we need action or just consensus?
That can be done via consensus, direction to staff.
all right.
Yes.
Our direction to staff is as such. Thank you very much for the presentation and for the work you put into this.